Hello, this is a wrap-up video for Module 5. Module 5 should be quite a bit of review for you because you have learned in all of your classes so far about the nursing process and what that entails. Again, remember the nursing process is assessment, nursing diagnosis, planning, implementation, and evaluation. If you're still a little bit hazy on that, make sure that you review that in your book because it's essential that you understand that in order to be able to answer questions on your test and future tests. We're going to start just briefly reviewing what an assessment is. Assessment is done on many, many levels. We have the physical assessment, we have the social and emotional assessment, we have a spiritual assessment, and we have a cultural assessment, along with, in mental health, psychological assessment. Most assessments contain some of the psychological questions, so some of those should not be new to you, but you need to understand what makes up an assessment. And again, what type of sources do we use? The primary source of data collection is the client. We get most of our information, or hope to get most of our information, from the person that we are assessing. However, in mental health and even in medical, sometimes the clients are not able to communicate with us. They may be in a coma, they may be mute, they could have so many psychoses going on that they're delusional. So in that case, we would use a secondary source, and those are family and friends, or even the police in some matters. That would give us more information. In many cases, you may have to use both the primary and secondary source. So make sure that you are understanding the difference between a primary and secondary source and what those could be. We also make sure that you are well aware and you're self-aware of how you're interacting with the client and how you're responding to them. You'll be learning about therapeutic communication later on, and that all of those strategies will help you. They will also give you a little bit of self-awareness and what you can do to help yourself out with being self-aware. It really helps a lot to understand what your predispositions are to certain situations. So you can kind of leave them at the door and not have them influence your assessment. And that can take some practice. All right. In mental health, we do something called the mental status exam. The mental status exam consists of personal information such as age, sex, marital status, religious preferences, that type of stuff, ethnic background, are they employed, what are their living arrangements. Then we have appearance, and that is something that we look at. Are they dressed okay? Do they have a level of hygiene? Are they showing facial expressions? Do they have scars? Are they handicapped? Do they have body piercings, tattoos, that type of thing? All right. And then that relationship between appearance and age. That can give us a lot of information if we have somebody who is bipolar, perhaps bipolar, and we don't know, but they're dressing like they're 16 years old and they're really in their 70s. That's kind of a clue as to something's going on. Another area is behavior. How are they appearing? Are they restless? Are they like almost in a coma? They're not interacting at all. Do they have any abnormal movements, such as what we see in tardive dyskinesia or tremors, which can be side effects from medications? And do they make eye contact with it? Now, eye contact, we've talked about before, can change depending on culture. So you need to understand what culture your patient is that you're interviewing, and then what you can expect to see from that culture so that we are assessing them appropriately. Again, we've talked about what is mental health, what makes a mental health well person, and that's, again, the intellect. What are they thinking? Are they thinking clearly? That affects their behavior and affects their affect and mood. So when we're assessing, we're looking at all three of those at the same time. When we look at their affect and mood, we're looking at their face. What do they look like? Are they very flat, which is that deadpan look? Are they angry? Are they appropriate? Are they congruent with their mood and their face? Also, are they sad, maybe labile, they're yelling, shouting, or they're euphoric, they're just in la la land? Then we're also going to be assessing their thought. What is their thought process? Are they abstract? And then the differences between, are they concrete thinking or are they incoherent? They may have flight of ideas. They may be doing thought blocking. So you will need to look in your book and make sure you understand those different terms that we use when we're describing a patient. Are they delusional? Are they obsessive? Do they have suicidal or homicidal thoughts? Those are all areas that we're going to be assessing as well. Next, we're going to look at perceptual disturbances. The best way to do that is just to ask, are you seeing or hearing things that are not there or that you believe are there that I'm not seeing? So hallucinations, auditory, visual, and even illusions. Then we're going to look at cognition. How are they? Do they know where they are? Are they alert and oriented times 3, which is that time, place, and person? Are they conscious? Are they confused? Are they alert? Are they in a stupor? Are they unconscious? Maybe even comatose. And then what's their memory like? What's their attention like? Can they handle abstract thoughts? Do they have any insight to their illness? Do they know why they're there? And then their judgment. So make sure that you review all of that and you really understand those areas and the associated terms that we would use in our documentation. We also perform a psychosocial nursing assessment, and that looks at their background, their social well-being. Do they have strengths and weaknesses? Can they tell us what their strengths and weaknesses are? Do they cope okay? And then taking into account their cultural and spiritual beliefs as well. We also do a spiritual assessment, and a lot of times this is overlooked, but this is particularly important because some of our patients are very spiritual, and their beliefs may not line up with the type of treatment that we want to do. So if we understand that, we can get the appropriate resources and referrals to have their care be more congruent to what's going on. We often ask, what role does religion and spirituality play in your life? Does faith help you in stressful situations? Those are those coping mechanisms that I talked about. Do they pray? Do they meditate? Do they want to participate in religious practices? On these units, some of these people are there for quite a long time. And so we need to offer them. They have the rights to participate in religious services, and if they're Catholic, even get communion. We also do a cultural and social assessment, and that is finding out what their primary language is. Do they need an interpreter? It's interesting that sometimes that's all it takes, and we weren't even aware because we thought they were just psychotic. Who are they close to? Who do they talk to in times of crisis? Do they live with somebody? Are they homeless? And if they know they're medically ill, do they have care? Is there somebody that they can go to, or is this just a reoccurring admission and they're not having follow-up care to stay well? We also need to verify data. Just because a patient says something doesn't always necessarily mean that it's truthful. It could be coming from a delusion, an illusion, something like that. So we definitely try to verify things that just make you kind of go, I'm not sure about that. With family members or friends and neighbors, a lot of time police officers, maybe their old records, medical records, and even their healthcare team from previous admissions. Now you guys all understand what a nursing diagnosis is, it's a clinical judgment about the response of a client to actual and potential health problems. And then we're going to come up with ways to intervene with those problems and try to have a positive outcome. Understand the components of a nursing diagnosis and what types of goals we could have and what is specific to kind of mental health. The ones that we see the most often in mental health are the NANDA approved diagnoses of anxiety, communication impairment, ineffectively coping, failure to thrive, grieving, and sometimes ineffective health maintenance. And those can be related to a medical diagnosis if need be, or the symptoms that we're seeing. Then we develop our outcomes and our short-term and long-term goals from that. And then we begin our implementation. Hopefully they work, and then the evaluation. All of this, of course, is based on interventions that are evidence-based as well. So evidence-based practice, EBP, that term that you're hearing a lot and you will continue to hear throughout your schooling and the course of your career, is super important. We're always using evidence-based practice techniques. Examples of practice intervention, just to give you an idea, would be counseling, milieu therapy, promoting self-care activities, getting involved with maybe OT for them to help with their ADLs. We do some health teaching. We also call in case managers. Remember, this is a population that is considered underserved. So case management is definitely important, especially with people with long-term and permanent mental health issues like a schizophrenic, a bipolar. And then we hopefully work on them with health promotion and health maintenance, which is really important. So again, review the nursing process, understand what we're getting at as far as a mental health client is concerned, and be able to apply some of those strategies if you were asked questions. All right, thank you very much.